So pretty much schedule wise, it's inconsistent, I would say. I mean, on a normal non-pandemic day, I would work typically 8 hours a day. But being that it's pandemic, our cases are up and down, fluctuating every day. It's been 10 to 12 hours, and sometimes, you know, either I come in really early or I even have to come in sometimes middle of the night to help, with meal coverages for staff. So it's been a pretty crazy ride so far.
Wow. Wow. So when you come in like the middle of the night and it's just like they just call you, say, "Hey, Catherine, come on in, like we need you." Like it's not something that you know ahead of time.
No, because we can't predict how many nurses would call in sick sometimes, or we can't predict someone's gonna get sick middle of the shift.
Hmm.
um, and sometimes, middle of the night, because the unit that I work in, we absorb the stable patients who come from ICU, basically. So if ICU gets loaded with a lot of patients, we have to help them out by sending some of our nurses over there. So then that just kind of impacts our unit and the unit that's, one level below us, and it just kind of it's a domino effect. And sometimes when that happens, you have less nurses on the floor and no one to cover for their lunches. And so sometimes management has to step in and just make sure there is enough coverage, because someone always has to watch the patients.
Yeah.
So that's how it goes. But I can't predict it. I can kind of anticipate that, oh boy, it's going to be a crazy night. But I've only had to come in middle of the night once, but hopefully not not anymore anytime soon. But it's just been, we can't predict the next few weeks, because we're now 2 weeks out from Memorial Day, and last week we had the protest happening. And so we are anticipating a whole slew of new cases in the next 10 days, because it's always like that, kind of in a cycle.
Hmm.
After Mother's Day, 2 weeks later, we were just busy because all the new cases started showing up. And now, Memorial Day, 2 weeks later, which was about last week, we, our number of cases just spiked up again. And so I'm expecting by next week, after all the protests last week, we're expecting, triple cases again. So I think in a matter of one day, we, in LA County, the number of cases went up to jump to like 1,600 in one day, when normally we normally just jump up 100, 200 cases per day, but it went up to like a 1,600 at one point.
Wow.
So it's just, we're not out of the woods yet with this
Mhm.
pandemic.
What's kind of, I know you kind of mentioned I guess the lag time, so to speak. Like you say, like after
Right.
Mother's Day was like 2 weeks, kind of like after Memorial Day. Is that kind of like the trend, I guess you've noticed, like after maybe huge groups of people kind of come
Hmm.
together, then about a couple weeks later, are they coming in because of maybe signs or symptoms, or like, how
Correct.
is that process?
Right. So I know around Mother's Day is when a little bit less restrictions, the restrictions were lifted up a little bit, meaning to say small gatherings were allowed. And that started around Mother's Day. So we started noticing the trend that about 7 to 10 days after, significant weekends or, events, cases would jump up. And that's about the time that symptoms, obvious symptoms, show up for people, such as, coughing. I mean, terrible coughing with no phlegm. All of a sudden, you're having body aches and fevers in the hundreds. And it's not just one day, it's 1 2 days of fevers, and you're sick with something. And it's not much, it's not really it's not suspecting it, that you might have it. You kind of lean towards you probably have it at that point. But about 7 to 10 days, I don't want to call it incubation period, because it all depends on each person,
Mhm.
as far as your immunity, and as far as how much of the viral load you absorbed in your body. Meaning to say, if you were exposed to somebody who was really sick and you had no protection, no mask, and you just kind of inhaled all those particles, you're probably going to get more sick than somebody who was around a bunch of people, but everybody was wearing proper protection, like masks, or staying away, social distancing. So it all depends on a lot of those factors.
Hmm. So then probably, because Father's Day is in what, 2 weeks, I think. So
Yes, 2 weeks
probably
out from
two
now.
weeks after that, it'll probably be kind of the same thing. And then 4th of July, right? So
Oh boy, yeah, that's right. So 2 weeks after that is
two
4th
weeks
of
after that
July.
too.
Yeah, and it's
I
on a
don't,
weekend as well.
yeah. So I'm sure
So
over this next month, month to month and a half, like,
right.
and then you even mentioned the protesting. So like combine that with,
Mm-hmm.
gathering type of events. We're gonna, you would kind of see just the trends are that we're gonna see kind of more cases within the next month or so, month to month and a half.
I would anticipate that. Um, and we're actually, from my viewpoint, from kind of from where I stand, being in the hospital myself, we're also experiencing a lot of our own colleagues, coming down with the sickness now, just because of how long it's been. Eventually, one way or another, there's a probability that someone's gonna get sick down the line,
Mhm.
no matter how careful you are. It's just because the restrictions are lifted now, and everybody's moving around more in the communities. You're probably going to get more exposure now, as opposed to a month or 2 months ago, when everybody really was quarantining and staying at home and social distancing. I mean, going to the store now, I don't know, social distancing is is not really, all there most of the time. I mean, people bump into each other now at the store, lately, that I've, experienced. So,
Mm, interesting. Um,
yeah.
so I know obviously there's a lot of information out there, but some
Hmm.
people also say that, you know, there are people that do not have a fever, but may also have it. Can you talk into a little bit more how maybe some people would have it and not have a fever, and then others maybe would have it and do have a fever? That question
So
kind of makes sense.
you, yeah, I mean, there are people who do test positive, but they're asymptomatic. So, meaning to say, they are carrying the virus, but yet they're not showing any obvious, symptoms, where there's not a fever or there's really no coughing. Um, and most likely they're not going to be really affected. But we do have, so there's mild cases, there's moderate cases where, after about 3 5 days, these patients who get admitted to the hospital, they're discharged home. But then we have the severe cases where, the more compromised individuals with comorbidities, with high risk factors, they have diabetes, they have long-term chronic diseases, they're older, um, not a lot of resistance to sickness. And they have been, a lot of these patients are in the hospital, for more than a month now.
Mm,
And the sad part is, you don't know when you're going to see your family members once you get dropped off at the hospital. Because unless we're talking end of life, and I'm not speaking just for my hospital, but for hospitals across, I would say, Southern California right now, there is a no visitation policy. And that's just for everybody's protection. We don't want to expose anybody else further. from getting coronavirus or the COVID-19. So the only time you probably will get to see a family member, and if they're not doing well, is when we're talking end of life and we're trying to decide, those making those decisions, what to do at that point. And so it's a pretty sad situation when you said, you left your mother or your elderly mother or your elderly father at the hospital because they're not doing well. At home, they have fevers, and then, the next time you get to see them, maybe a week later or so, you're saying goodbye.
Mm.
And they're not even in a state where they can actually, participate in that, interaction anymore, because they're probably at the end of life at that point. So it's pretty sad, because it's like, okay, I'm dropping you off, but I might have to say goodbye at this point. That's how it is for the most part for a lot of these, families.
Yeah. So in the top, so the ones that you've seen that have been dropped off by the family members,
Hmm.
when they're coming in, I'm sure obviously they are aware of what's going on with them, um, health wise, but
Hmm.
describe like their mental status, like a little bit. Can you really kind of talk into like what their mindset is a little bit, and like maybe they are sharing what their thoughts and kind of feelings are. Maybe they are afraid that they may no longer, are able to see their loved ones. Like kind of describe those
Right.
maybe conversations, from a general sense that you've noticed.
Well, now I'll speak from both the healthcare worker experience, and also from, the family experience. The family experience wise, it's you're feeling the loss already, because you don't know if they ever will come out of the hospital, and you don't know if that next phone call is to tell you, I'm sorry, Mr. So and so, but we did our best, and your loved one didn't make it. I mean, that could be the next conversation, and we've had those happen where, a family member got admitted to the hospital, but not even 24 hours later, you had to call the spouse and say, I'm so sorry, we tried everything, but he didn't make it, or she didn't make it. So those are the conversations we're having sometimes. But there are also situations where, we are really using technology a lot to do family visitation through FaceTime, which helps a lot to ease, the anxiety and the sad state of situation where everybody's in, where they can't really visit. And also from the healthcare workers' perspective, we are the family members once these patients are dropped off, because they have nobody, there's no human interaction except for us. Um, and there's no reassurance, there's no comfort, except, how when we interact with these patients, when we interact with them. And it's even more challenging when you have older patients, because we really have to, do our best to make sure they have that family connection, by making sure because they're not going to know technology. So we really have to be the ones, facilitating all of that.
Yeah, yeah. And even talking to maybe the treatment a little bit too, like
Hmm.
what it's kind of like for them. Is there the thought like, okay, that maybe looking at someone coming in, say, okay, maybe if we take care of them properly, we know that they're going to do better, like their prognosis, or maybe you come in and like, well, we don't like coming in saying, okay, maybe it's not going to look so well for this particular person. Do you already have that
Hmm.
idea in mind when people are coming in, or are you just trying to navigate it?
we we have to navigate it on a daily basis, because we don't know how they will tolerate the treatments. Some of the patients that we take care of, some of them, have been able to discharge home, and some, elderlies. And so in those cases, it's a case to case basis. It's a daily challenge, daily. I mean, we really look at everybody's treatment on a daily basis, but we kind of know if someone's really not doing well, and we watch those patients and we make sure that, they have a higher level of care before we need to, I'll speak medical terms, before we got to intubate them. We already know they might get intubated or they might be on a breathing machine. So what we do is we actually transfer them already ahead of time to intensive care if we need to, so that they are in the place already where they can get all the treatment that they would need in case that they get to that point where they really need to do all, the maximum treatment for everything. But on the good side, if some of those patients do come out on the other side and they do well and they get out of, intensive care and they get to the more stable units, when they do go home, we used to play the Rocky music as they're, getting wheeled out. And that, for me, when I first, jumped on board, and when I got back to the hospital, to my new job, when I heard that sound the first time, I was curious. I said, why are we playing Rocky here? And they said, oh, it's for those patients who get to go home, after being here with COVID. And so to me, that was really creative. And it's almost just like 5 seconds of music, but it just makes you stop and think, hey, people are making it out of this. And so there's hope. There's a lot of hope.
Yeah.
And we play the extended version, on our phone and our because they play it overhead on the hospital, but it's too short. And so when we actually take our patients down, we're playing that music all along, and it puts a smile on their face because they know that they made it.
Yeah. The As far as the follow-up goes for those that do get discharged and that do go home,
Mhm.
talk into like the conversations that you're having with them about like what the next steps are about their care to make sure that they're okay, long term, and things like that. Like maybe certain precautions they need to take, or you know.
Right. They're they're getting over a novel virus, and so there's a lot of there are still things that we don't know as far as long-term wise how the virus really affects the overall body. And so we're finding that those who, and these are studies out there as well, that we're finding that those who get intubated, as we call it, or get placed on a breathing machine, long-term wise, they don't do as well as if we could have prevented them from being on a breathing machine. So as much as possible, we try to do everything we can so that we can prevent anybody from having to have a tube down their mouth, because it just the whole process of being intubated and how the air flows into your lungs when the breathing machine is doing its job for you, breathing, I guess they're finding out that it causes more damage to the lungs. And so as much as possible, we're trying to have these patients who are able to follow instructions, awake and alert, and they can follow instructions. We have them flip over on their tummies. We have them on their side so that, the lungs are still doing what it does normally, instead of having a machine do it for them. So it depends. If the patient, if the individual was not intubated at all during the time that they were in the hospital, they tend to do a lot better. But for some of the individuals who have gone home and they needed that higher level of care, the intensive care with the breathing machine and all that, they seem to not be doing as good as their counterparts. And so that goes, for other patients in other hospitals in other states as well. They're finding out that not really a study, but those are the findings that are coming out right now, that we try to avoid having to put an individual with a breathing machine, because it just there's more damage to the lungs, I guess. That's the simplest way to say it.
Mm.
And then long-term wise, as far as taking care of themselves, I would say, if my family member was coming out of, being in the hospital for so long, um, there needs to be a lot of support, but at the same time, a lot of precautions still, because we don't know if other members are also carriers, and then you get re-exposed and your immune system is really not that good. So just, a lot of precautions. There is a bridge program that I guess that we are monitoring these patients who come out, and, we're trying to make sure that they still monitor themselves, temperature, their oxygen saturations, and all of that, for, a good amount of time after they leave the hospital, because we don't want to make sure that they don't have to come back and that they recover in their own homes.
Yeah. Have you seen some people leave and then come back? If you have, about how off, or about what percentage, if you had a guess, or maybe like what percentage of
Um,
people?
I haven't looked at the data on that area, but I do see, individuals come back, and we would anticipate that, just because, again, it's a case to case basis with how people's immunities are, and how really, how the support system is at home. If there's also more exposures when they get back at home. So we've had, and that's just in my hospital, but I believe in other facilities where you have multiple family members in the hospital at the same time. And
Mm.
so it's pretty sad, actually, when we were I would say that at the peak of all this, back in March, April, where you see family members, multiple family members all in the hospital at the same time, and you don't know who's gonna get out. That was the pretty sad part. But because, some passed away, one member would pass away, and then the other two, they're still critical. We don't know, who's actually going to make it. And so, and none of them know, that they were all in the hospital, because they're not aware of what's going on.
Mm.
So it's been, I guess, a game changer, this virus, because it makes you rethink of operations and how we deal with a crisis, actually, because it's just been crisis mode for everybody in the healthcare field since, I would say, March. And so the new normal, it just keeps changing, basically, on how we deal with treatments and how we deal with, the flow of things, when we get patients, and how we treat them when they get, discharged. So it just makes you rethink that, hey, this might be happening more, maybe. And so we got to rethink of the next wave. And, if there's another surge, how do we deal with a whole slew of patients? What if there's more in the future? How are we going to deal with that? And I mean, the supply and demand, there's not a lot of healthcare workers, we got to think about exhaustion and fatigue pretty soon, because a lot of them are emotionally fatigued and physically fatigued. And so there's not a lot of replacements, to kind of backfill that if people do go out on sick leave.
Yeah.
So that's the next challenge that's coming up, most likely.
Yeah. You mentioned the fatigue factor for the
Mm-hmm.
workers, right? So
Mm-hmm.
even talking about yourself, I'm sure obviously mentally, like you said, obviously emotionally, but also mentally, it's like, man, this is like, so it's like a constant, almost like a constant battle that you're in, that you're, dealing with, like, how am I going to help these people? Obviously when you go into that line of work, you anticipate taking care of people who are sick,
Mm-hmm.
but I'm sure, like you said, it's a game changer, right? This is something that, new for so many different people. So talking to like how you're um, dealing with it and kind of coping and taking care of yourself, because how can you, right? I'm sure you understand this, like, in order for you to take care of other people, you also have to take care of yourself. So
Mm-hmm.
talking to like how you do
Absolutely.
that. Yeah.
I'm pretty, I guess for me, I'm pretty fortunate that I've had, you know, 1 year of, I guess I tell other people I took a sabbatical for a year from the healthcare field. Um, and for me, coming back, I felt like it was the right time and the right state of mind when I came back, because I had a whole year of really enriching my mind and strengthening my mindset along with other things. And um, taking a break from being in that industry to go into something else and then coming back, you know, you have a fresh set of eyes, fresh set of perspective. You look at leadership differently, you look at relationships differently, you look at, really for me, empowering people. I look at that so much differently now. Not so much from a management perspective, but more of a, you know, empowerment perspective, because a lot of the people that I do have to manage, you know, there's a lot of emotional distress, emotional unrest. And so a lot of reassurance is needed, a lot of encouragement is needed. And so for me to be doing that every day, you know, that's kind of my role that I, you know, had set for myself, is to be the voice of, you know, encouragement and the voice of empowerment for a lot of people. But I got to take care of, you know, that mindset too, and um, that core, because if I do that every day, it will get exhausting. And, you know, you can't fill other people's, I guess, glass if your own glass is empty.
Mm.
So for me, really setting the day right, and just, you know, waking up and just setting that time to be mindful, to have meditation, to, you know, be prayerful, and to start the day really being grateful for a lot of things. It just, you know, shifts a lot of things, you know, and makes me not as stressed and as rushed as, you know, I would be if I never left healthcare field for a year. So really having that structure in my life, you know, I really am so, um, I try to be consistent as much as possible with having that mental break at the beginning of the day, and making sure that I have a good mindset before going into work, because once you're there, it's nonstop, and you have to attend and address needs left and right 10 hours straight, basically. Sometimes there's eating is like, you know, eating as you go, eating as you're working. And so because there's just a lot of you know, things that to deal with, you know, left and right, unexpected things, things that are scheduled, and just, you know, people's, you know, small things, big things. And so you just have to balance everything. But if you don't start your day with a good handle, you know, right here, the day is going to run you. I think it was Aaron Downey who said that, you know, don't let the day run you, you run the day. And so making sure that you have that mental, you know, fortitude and the mental strength to like just keep going, but, you know, make sure that you're mindful of all the little things, you know, to stop and just make sure, okay, am I doing this right? You know, because people will rush you a lot of times, and people want answers right away. But you just, you know, with every decision, with every word that you speak, you just have to just be mindful of, okay, am I saying something that would be helpful? I mean, if it's correcting somebody, am I saying something that, you know, won't further, you know, make them, you know, anxious, or, you know, lower the morale? You know, it always has to come from some voice of for me, I always just, you know, if am I correcting somebody or critiquing somebody, you know, because we still have to maintain patient safety at all times. But I do it with a voice of love and a voice of support. Hey, I'm correcting you because I know you probably didn't mean to do this, but, you know, we're all accountable for everybody's safety. So I just want to, you know, that's how I relate to people now. That's how I coach people. But taking the time for myself to make sure that I have a good mental, you know, well-being is also very, very important.
at the end of the day, do you have a routine as well that kind of like helps you maybe decompress a little bit? And if so,
Oh
like
yeah.
kind of walk us through that a little bit too. Because I'm sure like after, going through everything, you're like, okay, I have to get myself right again because I know the next day it's going to be kind of
Yeah.
the same thing.
So I have a four-legged kid waiting for me at home when I get home, and there's no there is no getting out of, walking him to the park, or, just taking a walk for 30 minutes. And whether I had a good day or a bad day, I have to walk him. He's expecting that. And that, I think, that structure, that consistency, that routine helps me just reset everything and just forget about, what happened at work. And, it's forcing me to actually do a physical activity that, is not at the computer, at the laptop, working away even as I get home. Because, we really have to force ourselves to just do something that is something that's normal, I guess, playing with your kids, or, walking to the park. And with this pandemic, we live next to a park, and I have seen so many families, walking together, playing together at the park, in the afternoon. And it's refreshing to see, because I've never seen that happen, where, a lot of these families are actually doing physical activities together, because the parents are working from home. But for me, having also that time to just, at the end of the day, 30-minute walk, with my four-legged baby, it just helps me kind of reset the day all over again, and make sure that, hey, take a mental break from everything and just forget about everything, because it will drain you to just keep going at 90 miles per hour, with everything in your mind. So
Yeah, yeah. You mentioned how obviously the exposure of operations and how we are or not set up in the medical field and like handling cases like this. I know I did a quick pivot, but because there's the thought that it could, like you said, it could come back and it could be potentially
mhm,
worse depending on when
right.
it is, especially now because we're in the summer, we're approaching summer, but then who knows what can happen in the fall and winter, again.
Hmm.
So like how do you kind of see it as far as what you're hearing or seeing, or do you have any thoughts on how things could be in the near future?
um if we don't prepare ahead of time, we're actually preparing for winter now. Because, if can you imagine, I mean, wintertime, it's going to be both the flu virus and coronavirus at the same time. um with the flu, a lot of people, don't really, I mean, I would say not a lot of people, but there are people out there that, don't believe in the flu vaccine, that it really doesn't do anything to that, it doesn't really protect them. But now you've got two viruses, that are around now. And so, um I just feel like, anticipating wintertime, it's going to be hard to tell which is what, as symptoms are relatively almost the same. You've got fever, you got muscle aches, you're coughing, and it really comes down to getting tested and to see which virus that you have. um but to mitigate, having the worst possible scenario this coming winter, I think, we are already planning ahead, 6 months ahead of time, to make sure that, hey, if we have a whole slew of, cases in the winter time, how are we going to deal with this? Because we were prepared for this time around. And it was almost like preparing for, as if we'd gone into war. Just because areas where we never had patient care before, we had set those up as possible areas where, if you had a major disaster, that's what it would look like. And so that's how prepared we were. That's to the extent of how, we changed a lot of things. um, but that could be the new normal in the future. But the good thing is we already know what we need to do, and that we were able to do it 6 months ahead. So we kind of know what we would, we would anticipate doing come winter time. And hopefully it's not that way, but worst comes to worst, being prepared is key. I think if you fail to prepare, then you're preparing to fail, is the right, quote. So
Yeah, yeah, that is very true. You obviously mentioned the flu as well, because
mhm,
you're dealing with two viruses.
mhm.
Are there huge differences in treating the two? For those who are not aware of, how they're being treated, like, are there huge
Yeah.
differences?
Well, a big misconception for a lot of people is, with the flu, it's a virus. And a lot of people think, well, I'll just take, a Z pack, an azithromycin pack. So antibiotics are for bacterial infections, where with viruses, especially with the flu, or, they call it RSV for kids, the rhinovirus for kids, all it is just fluids and rest. Fluids, rest, and proper nutrition, proper hydration, because there is no really no straight medication for a virus. Really, it's just more resting your body and just hydrating and hydrating. Now with coronavirus, when coronavirus causes COVID-19, so it's, there are some trial antiviral medications right now. It's being trialed. Remdesivir is one of those things. However, we don't know, the effectiveness of it, because it's the first time that it's out there. But it seems like a lot of people on this trial is doing good, is doing fairly well, I should say. But I'm curious to find out, as to the efficacy of this new medication, of this, viral drug, antiviral drug. We'll see, I guess, after this first set of wave is done. We'll find out more about how well it did as far as treating those cases.
Okay. Well, Catherine, really appreciate you taking the time.
No
Um,
problem.
yeah, out of your busy day, I know you got to take that time for yourself, before you get back into it. And we really appreciate all that you do, making sure people are safe and healthy, and really appreciate you taking the time.
Thank you very much, and I hope I can shed some light as to um, the kind of the inner eye set of eyes in the medical field right now. Coming right before this pandemic, I coming back into this new job, I wasn't expecting, to jump, and hit the ground running per se with this new job. And lo and behold, I never, when I actually when I accepted the position, I never knew that my unit would be the COVID unit. And at the same time, you know, that things would be the way they are now. And so it's like I said, timing is everything. And I truly believe God puts us in the right place at the right time for the right moments, because, we were made ready for that situation. And so with our experiences, where we are at that, at our point in our lives. And so I'm just grateful to just be where I'm at, and to hopefully be a person of good influence to those around me, because it's badly needed out there. So thank you for, having me for your podcast.